All right. Hello, everyone, and welcome again. We'll just give it one more minute to get everyone to join in. All right, we'll just get started. And hello, everyone. Welcome to the Industry Showcase on October 21st. My name is Ashley Caesar. I am the Programs and Event Specialist here at Digital Health Canada. And during the month of October, Amazon Web Services presents Cybersecurity Awareness Month. And today's Industry Showcase is remote work, data security, and the impact on Canadian hospitals. Joining me today, we have Joy Wee. She's a VP of Customer Success for Amazon Web Services. You have Ido Giffen. He's a VP of Custom Success with Cyber MDX. And Imran Ahmad, he's the partner, head of technology, co-chair data protection, privacy, and cybersecurity for Norton Rose Fulbright, Canada. We will have time for Q&A at the end of today's presentation. So please feel free to type your questions in the chat box at any time, and we'll get to it at the end of the presentation. So thank you all for being here today, and I will pass it on over to Joy.
Well, thank you, Ashley. Thank you so much, and welcome everyone. It's an honor to be here with you, and thank you for investing your time with us today, wherever you're calling us from. My name is Joy Wee, and I am the National Partner Manager for Healthcare and Life Sciences here in Canada with AWS. I'll be moderating alongside with Ashley the chat throughout the session, so I do urge you to share your thoughts, comments, and questions for the panel along the way, please. So before we dive into introductions and discussions, let's make sure everything is working. So audience, I need your help. Please drop in the chat for Ashley and myself for us to get to know you a little bit better. I'm not sure about you, but like myself, I've been actually locked down since the pandemic started. So completely unrelated to work, as we all look forward to more countries reopening their borders and to a safer pandemic recovery. If you could go anywhere, where would you go? Please share with us in the chat box, please. Thank you, Carrie. I see. I'm also secretly collecting a list so we can all go on vacation together.
Maui is my first choice as well. First thing I thought was Hawaii.
Fantastic. Oh, okay. All right. We are definitely secretly collecting a bucket list, and all of you are invited, and we will make a trip together. That's awesome. I can see all the suggestions and Ashley places to go here. That's awesome. Thank you for sharing, everyone. Well, our goal today is that whatever your role is in this industry, that you will come away with something, a new idea, fresh perspective, and that you can apply to tackle your security challenges, as well as hopefully to help you sleep better at night. Here's the format to give you an idea of what to expect for the next 45 minutes or so. We'll take a few moments to briefly introduce our panel and share with you a little bit about them. I'll kick off the conversation by asking some questions, hopefully to draw out some high-level trend lines that we should be thinking about. We'll also save some time to open up the floor where Ashley and myself will give you an opportunity to ask questions that's weighing on your mind. So let's get started. Without further ado, Joining us live from Tel Aviv, please welcome Ido Geffen. He is the VP of Customer Success at CyberMDX. Ido is an esteemed CSA 405D task group member. And did you know Ido served as a warrior and paramedic in the Special Elite Combat Engineering Unit for the Israeli Engineering Corps. He is a recipient as well of the Prime Minister's Prize for the Best Technological and Operational Project Achievement Award. I can go on listing more and more accomplishments, but we'll run out of time. So pleasure to meet you, Ido, and thank you for joining us. And next, I would like to actually welcome, please meet Imran Ahmad. He is a leading cybersecurity lawyer. He is also a Canadian head of technology and innovation. Imran is a co-head for data protection, privacy, and cybersecurity at Norton Rose Fulbright. He often acts as a breach counsel, and in the event of cybersecurity incidents such as data and privacy breaches, extensive experiences throughout in managing cross-border breaches and security incidents. On top of it, Imran is also a professor for cybersecurity and privacy law at the University of Toronto's Faculty of Law. So special, so special having both of you here today. And I would like to just dive straight into it to open it up for the panel, and let's get started with our discussion today. I'm sure we all agree that the internet plays such a major part of our lives these days, especially during COVID and the pandemic era. However, we all know that more online devices means greater cyber risks. Hundreds and thousands of medical devices, such as patient monitors, infusion pumps, ventilators, imaging equipment, are increasingly connected in our healthcare landscape. We've all heard of, the wave of cyber attacks on hospitals and sophisticated cyber criminals freezing data, putting lives at risk. These hacks are increasingly costly and are potentially deadly. So Imran, almost half of the security breaches in Canada here is in healthcare. Major health systems are having to shut down care, and it's a big problem. Do you think that the increase in remote work this past year had a hand in both the shutdowns and the data breaches? And what makes the healthcare industry so unique? Over to you, Imran.
Thanks, Joy. And just from the outset, I'd like to thank everyone, especially the organizers in particular, and our guests for the opportunity to be with them this afternoon. Really looking forward to the conversation. So the data point that you just mentioned, Joy, is quite reflective of what we're seeing in the Canadian marketplace and more globally as well. And there are a couple of things that I'd like to unpack in that question. The first part is, have we seen an uptick during the pandemic period, which I'll relate to a period of 18 months or so. So from March 2020 up till now, give and take. And the short answer is yes. So when we look at what hackers are looking at and what they're trying to do, imagine a triangle. And imagine at each tip, you've got data, hardware, and software. And what they're trying to do is exploit one of the vulnerabilities in one or a couple of those points of the triangle. And what happened was, during the pandemic, when you had a large workforce work remotely very quickly, sometimes IT departments struggled to make sure they could keep up with the demand. And as a result, sometimes you had folks using their laptop and connecting through a VPN tunnel, for example, or remote access, yet at the same time using it to surf the net, watch videos, and other sites that may have malicious code installed in there. So not the most safest way. In other cases, it would have been the other way around, where companies had provided laptops and devices, and now they're using it for other purposes, for personal use. So again, accessing sites that may have malicious code or not having good cyber hygiene. So we saw a 500% increase in the number of cyber incidents between March and April of 2020. Initially, and I'll admit I was wrong on this, I thought it would be a bit of a blip, that we'd see an uptick and it would stop or come back down. It has stayed a net high level, meaning there are significantly more breaches than there were before the pandemic. So that's just the new reality we've been dealing with. That's what shows up in the media, and dealing with those are a bit more challenging given the remote piece that we just talked about. But the second part of your question is really critical, and how is the healthcare industry a bit more unique? And you look at types of data that's out there about people. You can find my profile on LinkedIn, you can find information on the public sites, but there are two broad categories under Canadian privacy laws and globally as well that are deemed to be extremely sensitive. The first one is financial data. If you get my social insurance number, you get my banking details, anything that's financial and related to me, you can do all kinds of bad things, including identity theft. The upside, if you want to look at it for the silver lining, is there are tools out there to mitigate that impact. So for example, credit monitoring through one of the credit bureaus. Unfortunately, when you look at health information, the impact is very difficult to assess, right? Could be reputational. Somebody who has been diagnosed with a critical illness does not want that to be known. That you can't put a solution to get that genie back in the bottle at the end of the day. So the challenges there are very significant. Number one. Number two, the healthcare sector, amongst a couple of others, there's only 4 or 5, but energy, financial services, transportation, but health in particular is heavily regulated. And when something like this happens, where a breach occurs at a hospital, a clinic, long-term care facility, and so on, folks who are in the ecosystem, there's a high sensitivity because the regulatory scrutiny is very, very significant. I'm looking forward to the exchanges. I can unpack a lot of the points that I just made, but want to hand it back over to you.
Yes, well, thank you. That's a lot there and very interesting points. And I love to actually hear more about also your thoughts, Ido, on the same questions, and can show us a different perspective since you actually take care of a lot of clients globally as well. Ido?
Thank you, Joy. So first of all, I'm totally agree with Imran. The fast transition from in-person consultation to remote and teleworking, including remote connection solutions, potentially makes the system both more attractive and susceptible to cyber attacks. From what we were witnessing, there was a huge increase in everything that is related to phishing lure. We're seeing ongoing increase of spam and scams that going through emails. And especially in the beginning of the pandemic, we saw that the staff of the hospitals are more prone to press on malicious links and also download malicious files such as PDFs with malwares. I think part of the stress that was in the beginning of the pandemic, but we're still seeing a lot of malicious code deployment against healthcare delivery organizations. The hackers really try to steal the intellectual property that is related to COVID research, but as Imran mentioned, also EPHI, and we're seeing it all across the board against hospitals, laboratories, any other healthcare delivery organizations. And the top attacks that we were seeing in the last 1 or 2 years is the ransomware attacks. We're seeing more and more the usage of the double exploitation ransomware attacks, which basically means that the bad guys are, first of all, stealing the data, doing data exfiltration, and only then encrypting the equipment and the devices inside the hospitals. And this way they are taking an advantage to the fact that on the one hand, they really disrupted the operations of the organization, but also now they have a way to push them to pay them quicker because they're saying now we will also publish the data that we stole, we just stolen. And if in the past it was mainly against the device of the organization, as Imran mentioned, we're seeing more and more personal devices like mobile phones of the personnel of the hospital that now using their personal devices also as something for connection into the organization infrastructure. I think that something that really increased very significantly and pretty quickly is everything about remote and teleworking infrastructure. We're seeing a lot of hacks that are related to VPN, the virtual private network, the ability to connect remotely from the vendors' sites and from employees' apartments into the internal network of the hospital with solutions like Citrix or Pulse Secure. And we have seen from CISA a lot of alerts about one-day vulnerabilities that they're seeing out there that multiple hackers organizations are using and exploiting these vulnerabilities. And this is many times the entry point into those organizations. And on top of that, we're seeing a lot of cloud collaboration services such as Office 365 that because the adoption was very, very quickly, we've seen a lot of misconfigurations. And also there is a very lack of tools of how to monitor on how you're sharing data through Google Suite and others. So it also was a very easy way for the bad guys to steal data from hospitals. And I will add to that also everything that is related to unmanaged devices, which are a huge increase of IoT, OT, and medical devices, that many of them are with default credentials, with unpatched and legacy software, mostly without any endpoint protection. And adding again to what Imran said about what makes the healthcare industry so unique. So basically, I think that we can look on the hackers and divide them into three main groups. The first one are nation states. The second ones are cyber criminals, and the third ones are terror groups. And what we have found in the last few years that for each one of these hackers has a very good incentive why they're trying to hack into healthcare delivery organizations. So if you are looking on nation states, we had already 4 years ago a big breach into the Singapore's healthcare delivery organization that kept data on the Prime Minister of Singapore. And in this attack, we can understand that nation states can try to, take data about politicians, especially before elections, like we saw in the 2016, that there was a lot of discussion about the mental and the physical health of the candidates. So this is something that nation states can use and utilize. We have the cyber criminals that are mostly interested in money. So today, a record from a healthcare organization can cost almost twice. And as Imran mentioned, it can consist social security number, bank account data, insurance policy, which very helpful for doing a theft, a fraud. And also you have a very personal data on the person, like if the person has diabetes. So so for the cyber criminals, so the data can cost a lot of money on the black market, and also healthcare delivery organizations tends to pay more and quicker for ransomware attacks. And the last part of hackers that I have to admit that there is a lot of risk of guys, but we didn't see a significant success from those, which are the terror groups. I really hope that it will stay this way, but we can definitely, all of us can easily imagine what is the impact if all of a sudden all of the infusion pumps in emergency room are all of a sudden are shutting down. So with regard to why the healthcare industry is so unique, so on the one hand, we have a very, to every types of cyber attack groups, there is a very good incentive. And on the other hand, we have a very complex networks with a lot of types of devices and remote connectivity from the internet. So combined with it together, so many times it's the ROI, the return on investment from the bad guys is pretty good. I mean, it's pretty easy. I mean, it's much easier to hack into a hospital than to a bank. And on the other hand, the amount of money that the bad guys can take is pretty higher. So I think this is what makes this industry so unique and susceptible, and remain constantly in the top of the industry under cyber attacks in the last few years.
Thank you. Well, you know what? I'm soaking all of this up, and I've just learned just in a couple of minutes between both of you some key points here that I never actually even think about. So my takeaway is cyber attack in the healthcare industry is not an if, but it's actually a when it's going to happen. And I'm actually we'll transition actually to the next question I'm super curious about is that Imran and Ido, for both of you, what is the one story or particular case that stands out in your mind in the years in the field that you still think about, and that you can offer our audience that can learn from this experience? The one unique case that stands out and is still forefront in your mind. Let's actually start with Imran for this.
Sure, no, happy to. And I'll talk about one in the healthcare industry that's a couple years old now. So for a lot of our listeners, they will be aware of this. When it comes to the healthcare industry, it's a team sport. It's not just a hospital. There are different stakeholders that are going to be supporting physicians and healthcare service providers that may be outside of the hospital as well. So think of long-term care facilities, think of clinics, think of doctors' offices that are offering ongoing support and help and so on. So there are a variety of service providers in the space, and one in particular I recall that was based in central Canada had an incident where it was a ransomware issue. And the amount wasn't significant, but for all kinds of reasons, the client opted not to pay. So their position was, we will take what happens, but we were not going to pay. Now, here's the interesting part. Because they're part of the Canadian publicly funded healthcare system, they're interconnected to different organizations at the ministerial level, at the local hospital level. In Ontario, for example, you have what we call LINs, which are local health networks that are established. So they group together multiple establishments like hospitals together for buying power and administrative reasons. And so you had this organization, which is outside of the hospital area, that offers ongoing healthcare services, who refused to pay the hacker. They believed that they could restore and build from backups. It would take them quite a bit of time, but they were willing to do it. That bit of time was something estimated initially to be 10 days, took significantly longer, almost 3 weeks. And they had to basically at the same time do the following. One, they had to say, we can't do the work. And they were critical supplier of services. Therefore, they had to find alternatives, recognizing they would lose their market share. So you can see the stress grow right there. Secondly, their systems were interconnected. So it's not like somebody sends over a fax necessarily. These are actually coming through email, or they're coming through an integrated system. But when you tell someone, one of your business partners, hey, my system has been compromised, the first thing that they do on the other side is say, let's cut off the link, because we don't want to on our end get infected. It's a common practice. So regrettably, in that situation, the client was sort of dead in the water, quite frankly. They had no ability to generate revenue. They had to divert their business to potential competitors while rebuilding their environment. And had they paid, because they did a postmortem, it still would have taken them quite a bit of time, because even if you get the decryptor, for example, in a ransomware situation, the concern then becomes, if you were to roll it out, is it going to be safe to use? Are there any backdoors? And so you have to still contain it. So they would have been, in terms of time, in the same position. The one silver lining in that case was there was no evidence of data being stolen. But I'm quite sure and convinced, had data been taken, they probably would have opted to pay. And I'll mention this because I want to build on what Ido had mentioned, which is absolutely correct. There is a higher sensitivity when it comes to personal health information. And as a result of that, even when you don't need the decryptor and you can restore from backups, senior leadership will say, I don't want to be known as the one who took it too lightly and had information basically released into the public realm without authorization. If I can do anything to minimize that, I'll do it. And that's where at some point, I know we'll talk about this, Joy, but the role of insurance and cyber extortion payments, we can talk about that a bit later. But certainly that's one case that has stuck with me, because I don't think the outcome would have been the same today.
Fantastic. And Ido, you know what? I would love to also double click on that whole realm of insurance a little bit later. Ido, what about you? What is that one case that still basically is fresh in your mind that you've experienced?
Okay, so I think that one that comes into my mind when I'm trying to think of one event that really, for me, illustrates the problem is something that we've witnessed about 4 years ago with one healthcare delivery organization that was just deploying a new set of smart visions that was put in the waiting rooms. across the hospital. And as you can imagine, I mean, those television by default are connecting to the internet. And those specific ones was with Android operating system and was with default credentials. And the thing is, with those type of devices, that what we have witnessed that there is an onboarding of new device in this particular organization when it comes to a new medical device or a new workstation or a new server. But what happened in this case that because it's a I don't know, I mean, it's not you know, something that is really defined well exactly who is responsible for this type of devices. So one of the logistics department just ordered those devices, and of course it was from good reason. So it will be very interesting for the people that comes to the hospital to see television once they're in the hospital. But what happened that the configuration was that those television had an direct access internet, and on the other hand, they were also connected to the internal network of the hospital. And what we were able to identify is the fact that one of those televisions all of a sudden started to communicate with China and to the internet and into the internal network. We've seen an attempt from this smart TV to try to communicate with internal resources of the hospital, such as infusion pump and imaging devices. Like really starts to do what we are calling it a reconnaissance, try to understand what they have in the same area in the network. So specifically this type of attacks really was, at least to me, and I think also to my organization and to this specific customer, how easily this type of attack can happen. I mean, this device doesn't have who is exactly responsible for. There is no one console that's managing all of those devices. There is no endpoint protection like antivirus or EDR. And also the context. So for traditional IT personnel to understand that this IP address in the network is a smart TV and not one of the computers of the admins, the administrators. So there is so it's pretty clear there is any reason for a smart TV to try to communicate and manage other internal resources of this facility. And in this case, there was pretty good segmentation. So there is no way for this device to being able to communicate with the devices that are not in this specific segment. But I think for me, it was a very early wake-up call of the huge transitions that we have right now with healthcare delivery organizations that on the one hand, keep in their, the holy grail about data about patients, life supporting machines like infusion pump and so on. And on the other hand, you have purchasing of a lot of IoT devices, unmanaged devices, that many of them really, really prone to cyber attacks, and by default are trying to communicate with the internet. We are all used to do it. I mean, once we are connecting a new IoT device to our home, we're expecting from the new coffee machine to do an automatic upgrading and so on. So the perimeter, to understand that the perimeter of those organizations is thinner and is much wider than what we had in the past, that you have all of the devices have some firewall around it. And now it's much more interconnected between the employees that are outside of the organization, the vendors, IoT devices, and so on.
You know what, that's also an eye opener. Thank you for that, Ido. The fact that, introducing, for instance, peripheral devices such as a TV can actually cause so much injury, right? And it's cohesively, comprehensively, we need to actually track all the devices, like you said, the managed as well as the unmanaged. I'm actually love to actually jump back to Imran on where he left us off on the topic of healthcare insurance, particularly cyber insurance generally covers business liability for data breaches involving sensitive customer information, such as, the social security numbers, credit card numbers, account numbers, and driver's license, and so on and so on. So Imran, what are your thoughts on cyber insurance? And could you actually sort of share with us your expertise in this realm and your thoughts on the healthcare industry, how they are using cyber insurance, as well as how do they know if they have enough cyber insurance in the first place?
Yeah. So my first comment and disclaimer is I'm not an insurance expert, but interacting a lot with the insurance firms that are offering cyber insurance, I can shed some light in terms of what cyber insurance is, what it typically covers, what the current market looks like, and where maybe it's going in the future as well. So as a general proposition, cyber insurance is a relatively new product. It's only been around about a decade or so, which is pretty short in the lifespan of insurance policies. And it initially started out as a privacy-related insurance policy. So if you had a privacy breach, you could trigger this policy. It's now evolved to be called cyber, which could include other things such as trade secrets or ransomware and so on. But if you had to break it down, there are a couple of key buckets that cyber insurance covers off. There are variations to it, but generally these are the buckets you typically see. Any legal cost is typically covered. So if you need a lawyer to guide you through the process or navigate through legal requirements, there's a budget for that that's typically contemplated in the insurance policy by wording. And the reason is not to sound self-serving is lawyers can assert legal privilege when an investigation is going on, which is the highest level of confidentiality you can have. And that's what typically the insurer will want you to have in terms of process. Number two, probably the biggest piece of the investment short term is the forensic or the IT support that you need to contain the incident, restore the systems to whatever position they were at before, minus the vulnerability, and then do a forensic investigation to figure out how the bad guys got in the first place. So that's chunk number two. There are other buckets as well, such as crisis communication in case a reputation gets harmed, credit monitoring if you have to issue, for example, like you said, for social security numbers, any kind of credit monitoring tool and so on. And their services for call center. So basically managing the bridge and managing the notification regulatory component. So that's what I call direct vendor cost. The second broad bucket would be cyber extortion fees. So in most cases, given how many ransomware attacks we see these days, if there's $1 million ransom demand that's being asked of you, and assuming you meet all the requirements of your policy, and say your policy had up to $1 million, you can tap into that to make that payment. There are a lot of conditions to that. I'm grossly simplifying it, but certainly there's cyber extortion coverage. And then two last areas. One would be in the area of liability from a third party. If somebody sued you, as an organization that had a breach, how would you defend yourself? The policy contemplates defense costs. And probably the most complicated one is, what is the business interruption cost? So if you're hit with an incident and you're down for a week, 2 weeks, 3 weeks, there may be some dollars and cents you can go and collect under your policy. But again, for all of those conditions or all of those buckets, I do encourage folks to talk to their broker, because devil's in the detail is cyber insurance policies are very much customized in some cases. Some require consent, it's on a reimbursement model. So there's a variety of things to keep in mind. It's not just having insurance as a general proposition that will get you to where you need to get. The other thing I just wanted to mention on the insurance piece, which is really important, when we talk to our clients, we say, look, insurance is phenomenal as a tool, but it's one amongst other risk mitigation tools that are out there. So essentially what insurance is you're taking the risk of the organization, you're transferring it to another party. You can't transfer 100% of the risk in any situation. And given where the insurance market is, what I'll talk about next very quickly, there is a requirement to prepare before a breach occurs. So why do I say that? One of the first stats that we started out with was the increase in the ransomware or just the cyber incidents that have happened during the pandemic. If you look at Canadian data, although the data in Canada is reflective of global data, OSFI, which is the Office of Superintendent of Financial Institutions, which tracks what the insurance companies are making or paying out in terms of insurance, especially in the cyberspace, they were able to show us with the numbers that almost 2 to 3 times are higher the payouts than the amount they're bringing in, meaning for every dollar they bring in, an insurance company brings in premiums, they're paying out $2 to $3 in a claim. So net, they're losing money. As a result of that, when they saw that tendency in the marketplace, said, we're going to actually tighten the conditions. So where you were able to get $1 million, to get $1 million, you're going to pay much more, or you're going to get less than $1 million in some cases. So the condition is what we call in the marketplace is hardening, meaning it's harder to get cyber insurance in place, and there's significantly more conditions implemented. Which brings me back to the point you were making. What should organizations be doing, and what kind of risks are they facing? So insurance, try to get it, talk to your broker, get something that's appropriate for your organization. But more importantly, make sure you invest on the preparation side of things. I can't emphasize that too much. Because you can never 100% rely on the insurance because it may be capped or limited or not 100%, you need to do a lot of other things. And the example I give is focus on what we call cyber resilience. At the end of the day, think of somebody giving you a punch. If you can get back up and stand, that means you're resilient. The quicker you can do it, the better it's going to be for the organization. If you get punched in the stomach and you're down for a month, you're not going to be viewed as a very resilient organization. And I would also add the one quick point, organizations generally, public or private sector, healthcare in particular, are not viewed as being problematic in terms of having a breach. They're often viewed as a victim. Where they get in trouble is how they respond to the breach. If the response is poor, is lacking, or a bit haphazard, at that point, you're going to have people criticize it significantly. So I'll pause there. Happy to expand on that if you like.
And you know what, this is actually a great thing, because as you are explaining this to us and helping us understand, the importance, obviously, of the insurance part, a lot of what you do, Imran, I realize, is also helping preserving reputations. And you mentioned, healthcare, a little bit unique because it may be viewed as a victim, but how damaging is it as a typical breach for a healthcare organization, not just on the impact of revenue loss and operational downtime, but to their reputation and brand? And what do you advise your clients on when it comes to that?
That's a great question, and I'll give you an answer you won't be surprised to hear from a lawyer, which is it depends. But let me give you a couple of considerations for the audience to think about. If you are a widget manufacturer, for example, your reputational harm may be different than, let's say, a hospital or a clinic in the healthcare space. And I'll explain why, or even a law firm or an accounting firm or somebody in the professional services space. The reason is when people come and see their healthcare provider, there's an element of trust, which is much more significant than buying an item from the store with a brand. And so when you entrust an organization with your most sensitive data about your health, about your finance, or anything of that nature, when a breach occurs, it hits home much more than it would otherwise. And in those kind of situations, the reputational component, I'll tell you, when we speak to boards, when we speak to C-suite executives, when they're dealing with a breach, certainly legal is a concern. I won't minimize that. Operational impact is a concern. Financial loss is a concern. But the number one concern for the board is the reputation. Reputation vis-a-vis the ministry, for example, that's providing funding to the hospital, the healthcare service provider. Reputation vis-a-vis its employees, who may lose confidence that we're actually employing the right level of security in place. But more importantly, patients and the stakeholders that they're trying to serve. They're very concerned that if they lose that confidence, the reputation may be damaged significantly to the point that it may not be able to recover, or at least in the short and near term may not be able to recover to the point it used to be before. So I'll say in the health space, the role of a crisis communication firm and making sure that we really focus on properly managing the breach is more critical than in some other industries.
Thank you. You know what, a lot to consider there. And, I'm also taking notes on the side. Ido, this is actually perfect for you as a head of customer success. Then based on all the information, the insurance piece, the reputational piece, and also, yes, you can have insurance, but, the proactive early intervention, prepare before the breach happens. As a customer success representing VP, representing healthcare providers across the globe, what are your customers most concerned about, and how are you and your team making them feel more secure to prepare for a potential breach?
Yeah, thank you, Joy. So I think that the first thing here is that we're witnessing more and more some kind of a maturity in a good manner, of course, that they understand that cybersecurity is not only a technical issue anymore. I mean, it's not okay, IT personnel and cyber information security personnel, please take care of it. We're seeing a real understanding that it's a patient safety imperative. It's really can be dangerous if medical devices can stop working or malfunction. It's also understanding that it's a threat to data security. This healthcare data can be stolen or sold. And as Imran mentioned, it's also a huge risk to financials because hospital takeovers can hold for a ransom, for example. So when it comes to how to, making healthcare delivery organization feel more secure, I think that what I like to do is take them to the other side because all of us, I think most of us, we were always been on the the defensive side of cyber attacks. But as you know, you can say that the best defense is offense. So I really think that we need to provide healthcare organization the ability to see how hackers sees their organizations and basically to understand that it's true that cyber attacks can come from different directions and from different cyber groups. But in the end, there are few steps that are necessary. And there are, and every hacker will do those steps. The first one is the intelligence gathering in order to locate the organization that is interested in, to find email addresses, IP addresses, the website of the organization in order to find an entry point. Once there are options for an entry point, the hackers will try to deploy some malicious code, and then there will be some kind of communication of a command and control communication with the malware that was deployed. And once there is any kind of malicious code inside the organization, they will try to do a lateral movement in order to locate the data or the assets that they are interested in. And then, only then, there will be data exfiltration or the ransomware attacks. So once you understand that in the end, it's not, it's a process. And as you protect the patient against any a disease or any emergency event, then you have a procedures on how to take care of it. Because we understand how a heart attack, then you don't have blood into some area of your body and so on and so on. I mean, you have steps on how bad things happen. So, and then once you understand those steps, I think that it's really makes a lot of sense to come up with a layered approach, which basically means, okay, so now that I understand the steps of the hackers, I will try to put fence on each or few fences on each one of those layers. So, and it's true, there is still bad guys and hackers that will be able to get over your fences. But first of all, cyber attacks are some kind of economic, like any other business. And nation states and cyber criminals are working on ROI. And if it becomes too complicated or too long, and so sometimes maybe they will choose to stop and move to the other target. And the other thing is, once you have those this layered approach, so even if one of the fences got breached, it still took more time for the bad guys, and you have more time for an early detection, because that's okay. I mean, we need to understand that cyber attacks will continue happening, but it's really a matter of how quickly we'll be able to detect it and to respond, and to contain the problem. So I think that this is one thing that really resonates with healthcare delivery organizations, that that there is a way that hackers are working, and we also have a strategy on how to make it much harder for them. So this is with regards to, let's say, a real attack that now can emerge against healthcare delivery organizations. The other thing is that when we're looking on the future, So we really need to do what we're calling a risk management. And basically, there are two basic questions that needs to be asked: is where should I start? Okay, what can I do with that? And again, here I think that if you are building the right process on how to detect cyber risks that you have right now, and to understand which of your devices is vulnerable to known vulnerabilities, which devices are prone to default credentials, which devices are exposed to the internet, and now you're building a plan on how to remediate or mitigate each one of those issues. And again, the list is infinite, okay, right? You have a lot of security issues, but in the end, from our experience, there is 1 to 3% of security issues that, if they will be handled, the attack surface and the probability of cyber attack to be successful reduces very dramatically. So again, if you feel that you have, as a CISO or as an IT manager, or even as a CEO of a hospital, and you have a way to understand where should I start and what can I do with that, I think that this on the pre-attack side and with regard, and the other part is the layered approach for threat detection and prevention. At least for me, this is, I think, two key points that really resonates with healthcare delivery organizations.
Thank you. Thank you. You know what? So much to uncover and to learn some more. I'm more interested in learning more, but in the interest of time now, I'm just looking, Ashley, not that I'm ignoring you, and I can see there's lots of questions coming in through the chat. I was thinking before I actually open up it to the floor and address some of the questions for the audience, which you would like to actually pose to the panel. Is there anything, Imran or Ido, that, since this is actually the month of cyber awareness, October, here in Canada, is there something that we haven't touched on that you like to leave the audience with for them to, sort of anticipate or any sort of upcoming cybersecurity tools that are gaining importance or strategy that they should look out for moving forward?
I can maybe start off, and Ido, if you want to jump in as well, feel free to do so. I think I'll just give some general advice of what trends we're seeing. Last month in September, there were two major developments that happened on the ransomware piece. It's critical because ransomware is really the bulk of the cybersecurity incidents we're seeing. So number one, in the United States, although it does impact Canada as well, the Office of Foreign Asset Control issued a new guidance document on ransom payments. If anybody's thinking about making a payment for a ransom, they may have to make sure that they're complying with that piece of guidance. So that's number one. If they'd like to get a copy of it, it's available. If you can't find it, just let me know and I can send it over to you. Folks can email me. The other piece is NIST, which is a very well-known organization in the cybersecurity space, amongst others, has issued a guidance document on how to manage ransomware risk in particular. So what we're seeing in the industry right now as part of the preparedness part is not just having a plan, which is great, it's a requisite, but it's having a standalone ransomware playbook and a decision tree. When would you pay or not pay? And it's not as simple as, okay, we're willing to pay, let's talk to the hacker. There are different players you need to have involved, like a negotiator, a Bitcoin wallet that the other party is going to prepare for you. You don't need to buy cryptocurrencies. You don't need to get a wallet and so on. So a variety of key considerations in the planning side, because like I said, the quicker you can respond, the better you're going to be judged, in particular in the healthcare space. And I'll tell you, ransomware attacks are really focused on that area because of the sensitivity of the data that we were talking about.
Perfect. Thank you, Imran. And Ido, do you have anything you'd like to share with the audience before we open it up with Ashley to address some questions?
Yeah, so I would just mention that it's true that in the mindset of the cyber attack against healthcare delivery organization is not a matter of if, but of when. But we don't need to get into a panic and to understand that in the end, it's as we said before, it's a matter of ROI calculation of the bad guys And I do think that with some of working according to best practices and taking the layered approach of early on risk management and prevention, and also prepare the right playbooks and processes for handling a cyber attack once it will happen. I think that it will not stop everything, but still, I mean, the fact that we're still seeing sometimes a devastating attacks that are not a very complicated attacks that were done easily, but by not top-notch cyber attacks organizations. I think that in the 80% of the attacks, we can reduce and prevent in advance and I think that this cybersecurity month is very, very important for that, because once the awareness is there, it's already half of the solution. So I'm trying to keep optimistic on that end.
Thank you, thank you. And at the audience, Ashley, would you like to kick off? And don't be shy, audience. Please, if you can think of anything that you would like to actually post to the panel, Ido or Imran, feel free to share it in the chat, and we will address it during our last few minutes left in this session.
Yes, thank you, Joy, and thank you to all the panelists. We have one question here. What is your future prediction, how healthcare should protect itself?
Okay,
Imran
so
or Ida?
I will start. Yeah,
Okay.
so I will start. So first of all, we need to have a look on how future will look like. So I think one significant thing that we're seeing is adoption of cloud solutions. So we do see more and more infrastructure as a service that the hospitals are consuming. So we will need to add more types of protections and layers of protection against how to protect the cloud infrastructure that healthcare delivery organizations are starting to manage. A second thing that is increasing is the adoption of SaaS solutions, software as a service. We're seeing more and more EMRs, like even Epic, that are all the data is in the third party, or we're seeing usage of Gmail and Office 365. And I think this is also a place that right now there is a lot of gap. And if I'm combining the issues with regards to SaaS and infrastructure as a service, we need to understand that the identity access management is basically the new perimeter. So in the past, we had a firewall which protected all the on-premise devices and connected devices inside the organization. And right now, the identity, our ability to make sure that we're providing least privilege access. So each user will be able to access only the relevant data that this user needs to be able to consume. I think that this is a real challenge, and this is one of the key places that we really have to improve, and to understand that this is a big transition we are seeing in healthcare delivery organizations. Combining with that is the telehealth. I think that 2 years ago it was, and I think less than 1% maybe of the visits to hospitals were through telehealth, and right now we're seeing much more than that, of course. So the ability to protect and to make sure that it's keeping private what people that are in their home speaking with their doctors. So I think, in conclusions, I think there are three major places that we will need to tackle on top of everything that we've just discussed is the software as a service protection, infrastructure in the cloud, and also everything that is related to telehealth.
If I could just very briefly build on what Ido mentioned, and all the points you make, I agree with them 100%. I'll take a step back. When you think about leadership within the healthcare space, what they're all focused on, some of it is buzzwords, some of it is because of a real focus in the area, but across the board, they're all moving towards what we call digital transformation. And digital transformation is a combination of all the things that Ido mentioned. It could be using components of the cloud, using third-party applications, building a stack, optimization. It's a variety of things. So the definition is very broad, means different things for different people. I think the two things that folks should be ready for, who are actually implementing these technologies, we've talked about it, but I'll just call it out. One is what we call a PIA, or Privacy Impact Assessment. Most of you in the healthcare space would have heard about this. But the other piece that Ido was alluding to in his comments when he talked about defense in depth was this TRA, or Threat Risk Assessment, which now go hand in hand in most cases. So as you're implementing these large-scale digital transformation projects, having PIAs and TRAs done are going to be very, very significant part of that process. And they're going to get more and more complicated. One point that I did not cover in my points that I was mentioning is in Canada, privacy legislation, private sector or in the health sector is getting more modernized and reaching sort of what we see in Europe and in other parts of the world, GDPR type language, which are now requiring privacy impact assessments to be done as a minimum standard, not as a nice to have. So I put that out there because I do anticipate that being accelerated over the next 12 months.
Yes, that's great. And that just brings us to our next comment that says prevention is key to reduce risk of harm. All right, so we have time for one more question, and is, would implementing a national set of standards / procedures similar to those used in the financial sector help or be feasible in the healthcare sector?
Maybe I'll kick it off real quick, and then Ido, if you want to add to it. It's sort of the eternal debate. Should we have standards or should we have best practices? The challenge with the standards is it's a minimum requirement, and typically when you're looking at minimum requirements, people would invest and just achieve those. So that's a downside, right? You're not going above and beyond what's minimally required. When you talk about best practices, you're going significantly higher, but then it's voluntary in some cases. So who's going to actually invest in it or not? I think when you look at the financial sector, they have a pretty good idea of what they want to see in place. But the bigger piece, and I'm not saying this because I'm a lawyer, is the oversight. If nobody's actually looking at it, it's quite useless whatever standards are going to be implemented, because you can't validate the auditing or the compliance part. So for example, when you look at financial institutions like banks, they're regulated by OSFI, the Office of the Superintendent of Financial Institutions. OSFI has specific guidelines on doing self-assessments and then actually goes in every year and looks at what they're doing. So the ability for the technology risk division of OSFI to do that is quite material. We would need, if you're wanting to have a set of standards put in place, you would need to have some kind of oversight, not a nice to have, but really either a privacy regulator or a ministry or someone who's going to say, all right, you're going to implement these minimum standards. Let's check if you're meeting them or not. And if you're not, let's see how you get to the path to green on those pieces, which is getting to a place where you want to be at the end of the day. So it's a non-answer in a way, but it's one that I think that it's if we can get to that point of having standards, the enforcement or their visibility oversight piece is going to be critical to it.
So I would just add quickly to Imran. So with regards to standards, I think that especially around medical devices, we're seeing a good progress. For example, the FDA recently named Kevin Fu specifically to address medical devices cybersecurity. And the FDA really tried to seeks to require the devices have the capability to be updated and patched in timely manner. And this is including provide evidence and demonstrating the capability from a design and architecture perspective for a device updating and patching. So I think that this is the right thing, especially around medical devices that are life-supporting machine, and there is no reason for that, at least for the ability to update and patch those devices, that this is something that the vendors will be committed to. And with regards to best practices, so I think that there is a very good example in the US, the healthcare industry cybersecurity practices, which is a group that consists personnel from the US government, but also from the private sectors and from healthcare delivery organizations. And pretty much once in a year, they're publishing a set of recommendations and pains that are unique for cybersecurity for healthcare delivery organizations. So I do think that this type of initiatives are things in the right direction in the end.
Well, thank you. Thank you so much, Ido. And with that, we ran out of time. I said we actually needed more time. So perhaps in part 2, I want to take this maybe a few seconds to thank everyone, the audience. Thank you for, I'm super grateful that you share some time and, invested some time with us this today. And my guests, Ido and Imran, and also thank you so much, CyberMDX, and very especially thank you, Ashley, for helping us moderate all of and taking notes on all the chats. Thank you. Have a great day. Healthy wishes to all. Take care.
Yes. Thank you all. See you next week for our next session.
Thank you very much.
Thank you.
Bye-bye.
Thanks, everyone.
Bye-bye.